World Health Organization has just said that the novel coronavirus outbreak can be called a pandemic. New outbreaks have been reported in Iraq, Brazil, Greece, Israel, Nigeria, New Zealand, and the list goes on. There are now more new cases being reported daily from outside China than inside. But what is a pandemic? And why are the WHO only calling it one now? In this video, we're going to look at what that means and if it actually changes anything. So what is a pandemic? The word itself comes from the Greek for all and people, but that doesn't mean it has to affect literally every person on the planet. And currently there's no universal definition that everyone agrees on. We usually use the word to mean a new infectious illness that is spreading uncontrollably in different regions of the world, although not necessarily everywhere. And although the WHO has said people can call COVID-19 a pandemic, they don't give official classifications to illnesses themselves.
Pandemics as such are not declared. This is a characterization or a description of a situation. And the DG has said it is not a change in what we do. It is not a trigger for anything other than more aggressive, more intensive actions.
So why has the WHO only now called COVID-19 a pandemic? Going by the common definition, the coronavirus has some characteristics of a pandemic. It's a new virus and was unknown to science before December last year, and it's spreading rapidly across borders in multiple continents despite efforts to contain it. So it certainly appears to meet those criteria. But the WHO was reluctant to use the word pandemic until March the 11th. That's because although the virus spread to different regions, the majority of cases could be linked back to a source.
If we say there's a pandemic of coronavirus, we're essentially accepting that every human on the planet will be exposed to that virus.
But now the WHO has used the word pandemic because in the past 2 weeks, the number of cases outside China has increased 13-fold and the number of affected countries has tripled. But they were quick to urge caution in using this word.
Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over.
It's important to note that the word pandemic doesn't tell us anything about the severity of the virus, just the spread. Take mortality rates, for example. The WHO has put the global death rate from coronavirus at around 3.4% of those it infects, and that number also changes depending on which country you're in. So far, more than 4,000 people have died from the virus around the world. The mortality rate from Ebola was around 50% and it killed 11,000 people. Yet Ebola was never defined as a pandemic, as it was mostly within West and Central Africa. Just because something is a pandemic, it doesn't necessarily mean that it's extremely deadly. It just means it has spread far. The last time the WHO declared a pandemic, for the 2009 swine flu outbreak, it was criticised by some countries for unnecessarily spreading fear about an illness with a death rate of around 0.02%.
I have spoken consistently about the need for facts, not fear. Using the word pandemic now does not fit the facts, but it may certainly cause fear. This is not the time to focus on what word we use.
The WHO does have a pandemic preparedness plan, a guide for countries on what to do. It says governments should be ready to fully mobilise healthcare and make safety equipment and medical supplies widely available and distribute it where necessary. Take Victoria in Australia, for example. In their worst case scenario, they say they're ready to potentially lock down whole cities and close schools. They anticipate up to 40% of the entire country's workforce could be sidelined by the virus. They even say these effects could last up to a whole year. And in the UK, the government has an emergency plan which could shut down public transport and stop mass gatherings and events. But again, these are plans for the worst case scenario. Most countries are already taking huge steps to try and stop the virus's spread through quarantine and restricting travel. And most countries advise that anyone who thinks they may have come into contact with the virus to self-isolate until the incubation period passes. And that's currently thought to be around 14 days, although scientists are still unsure. Some people argue that labelling COVID-19 as a pandemic doesn't actually mean much, as it's already being taken seriously anyway, and wouldn't really change how countries are responding at the moment.
I think it's just a term, and it probably isn't going to make what we do different.
The major risk of the virus spreading out of control comes from it infecting those in countries which do not have advanced healthcare systems. Those places would be less able to cope with an outbreak and less effective at quarantining and controlling infection. That's when the virus could spread rapidly and the death toll could spike. And it's a situation the WHO desperately wants to avoid.
We're not saying that the world should move from containment to mitigation. 81 countries have no cases, so they should do everything to prevent from importing any case. There are 57 countries who have reported less than 10 cases, 10 or less cases. They can cut it from the bud.
So there you have it. That's what a pandemic is, why the coronavirus has now been declared one, and what it all might mean for how countries tackle the virus as it spreads. Let us know if there's anything you want to know in the comments below. And don't forget to like and subscribe Channel 4 News to stay up to date with the outbreak.